Tonight, Eisenhower Health says the number of coronavirus patients continues to drop, which is certainly welcome news for doctors and nurses. Meanwhile, the federal medical team at the hospital is now extending its deployment through September. I spoke today with Chief Medical Officer Dr. Alan Williamson. Dr. Williamson, it's good to see you again. Thanks for joining us.
Peter, thank you for having me again.
First off, what's the latest at Eisenhower?
So things continue to calm down here. Our numbers have stabilized now roughly around the 40s in terms of number of cases, and that's down from our peak where we were over 90. So definitely an improvement.
Is that a huge relief for staff?
Absolutely. Between having those numbers go down and the deployment of the U.S. Air Force crew here, they've really had a chance now to step back, get a nice breather, and recharge their batteries to be ready as we continue into the fall, because we know that this isn't over. It's going to continue for several more months, even though the numbers are more manageable now.
So the federal medical team is still there assisting you. Has there been an improvement with staffing issues?
Absolutely. The biggest change we had was really just a morale boost. The number of people that came compared to the total staffing at Eisenhower is not a huge number, but it was really an important morale boost to the team to see that we had help coming from outside. And we've just been notified in the last 48 hours or so from the Department of Defense that they're extending the deployment of that crew. So they'll be here through September 11th, which is a great help to us.
Yesterday, we spoke with the owner of El Paseo Jewelers, Raju Mehta, who recovered from coronavirus several months ago, but says he is still experiencing a lot of symptoms. Are you seeing people with side effects coming in months later from coronavirus?
Yeah, not too many of them have had to be readmitted to the hospital, but absolutely we're seeing a gamut. We see people, again, who are completely asymptomatic that test positive, never have any symptoms. We have people who have mild symptoms, don't have to be hospitalized, and seem to recover completely. But there is definitely a swath of patients that are more severely affected, who take much longer to recover, who are in the hospital for 2 and 3 weeks, many times on the ventilator for very prolonged periods of time. And for those patients in particular, a long recovery is a common thing that we're seeing among that group of patients. And even some patients that 3 and 4 months later seem to have very long-term damage that has occurred as a result of their infection. So still a very serious infection.
Are you still bracing for the possibility of a spike come this fall?
Yeah, anyone can guess what's going to come this fall. It's really very, very hard to predict. Are we going to see a flu season much at all this year because people are social distancing and wearing face masks? Or is it going to hit like it usually does and certainly complicate matters because now we have 2 respiratory illnesses going on at the same time? How many people are actually going to be able to travel and come and stay in the Coachella Valley this fall? So there's so many variables. We really are having a hard time predicting exactly where this is going to go. But I don't think it's going to be over before our season really starts to kick into gear. So I am worried that we will see some increased number of the cases, but hopefully still manageable.
How is the hospital doing financially, and are you seeing any shortages like with equipment or PPE?
PPE, we're doing reasonably well. We'd always love to have more. We're still having to manage that pretty carefully. Still getting N95 masks, for example, is still a challenge for everyone. But I think we have a pretty good process in place for us to manage those supplies. Financially, the community has stepped up in a huge way in order to help us with the extra costs. A lot of donations have come in specifically geared towards helping offset the losses from the COVID-19 infections here, the losses of income from the fact that we shut down surgery for a period of time, and even at this point are only operating at about 50 or 60% capacity in terms of our surgical volume, which is typically revenue generating volume for the hospital. So we're doing all right as far as finances go at the moment.
Nurses across the nation right now are rallying, calling for more PPE, and that includes nurses at Desert Regional. Many of them say they're having to reuse PPE, making them feel unsafe. I'm curious, is Eisenhower having nurses reuse PPE? And do you believe it is safe for them to reuse it?
We are using extended use of some of the PPE. So we definitely have, we've kind of converted recently to using face masks plus a face shield or goggles so that there's extra protection for the staff. And we do have them wear that for longer periods of time. So traditionally, when we're caring for infectious disease situations, we are used to a disposable society where we put on disposable gear, walk into the room, take all of that gear off, throw it in the trash can. And right now, with the supply situations around the country, we're not really able to function that way. So we are doing some extended use where the nurses will change an outer mask. They'll wear an inner mask through their shift, but change the outer mask, a ear loop mask over their N95 mask in between patients and so on. So there's definitely been some modification in how we practice. But I think we are safe in doing that. All of the indications from CDC and World Health Organization is that it is safe to function that way. But it is a change to the normal workflow. So I understand the nurses are concerned about that. Our infection practitioners have done a fabulous job of talking to the nurses, researching all the data and literature out there to be sure that what we're doing is safe.
Dr. Williamson, we appreciate your time. Thanks for joining us again.
Peter, thanks very much.